One is one is AB 260, which is a shield law in a sense for our providers. I don't know about you, but whenever I have my doctor looking at me, I want them to be focused completely on me. And if they're prescribing medication abortion, I don't want them to fear losing their license, which I'm sure they worked very hard for. And also fear of criminalization for just doing their job and taking care of their patient. And also AB 55, which is our alternative birth centers legislation. And we realize there's a maternity ward desert here happening in California. We have 12 counties that are completely without a labor and delivery department at their local hospitals. And so this is going to help streamline that criteria to get more alternative birth centers there, which we have found to be not only a cost savings for the state, but also that it is more holistic, it is more culturally competent, and you have access to more of that wraparound support that you need. So that's just a little bit about myself, and I will pass it over to Sadia.
It's hard to follow up Dr. Lakisha. But I will say I started really getting into policy as a student in high school and eventually in college. I saw so many disparities amongst my classmates, myself, and the way our, cities and localities were impacting um, our families by the decisions they were making. But specifically forced marriage and reproductive justice work is something that I think I've slowly come more and more towards myself as a survivor and having experienced forced birth myself, and also finding so many folks that are being forced to give birth or stay in relationships where either religion, culture, or just various coercive mechanisms are used to push young individuals to give birth, even though they do not want to or do not have the capacity to. And so ultimately, those are decisions that should, come from the individual themselves. And so it's something that I've been working on and trying to, bring culturally competent knowledge to communities about. And in that line of work, like we have this year gotten AB 1134 to the governor's desk, which is starting specifically with just recognizing that forced marriage is something that impacts everyone, regardless of their gender, and to also, create some exceptions within the legal system to file annulment for forced marriage. And this is setting the ground for us to then introduce the forced marriage protective or restraining order this upcoming legislative cycle. We're hoping that this can be a shift in California policy on how we engage with forced marriage because it's happening whether we recognize it or not. California has more than 3,000, more than 9,000 cases every year of young individuals that are forced into marriage, not even adults. We don't bother to even capture data on adults, which is, really hiding what's truly happening in our community. But we're hoping that, through these mechanisms, through changing these policies, we can create a space to actually acknowledge what's happening in our community and also create protections and intervention models so that, folks can be safe in their homes. Folks can be safe to make whatever decisions they want to, whether it's about their reproductive rights, whether it's about who they want to marry. Those are things that should not be taken from anyone. So yeah, thank you for having me.
Well, thank you all for those introductions. This is going to be a rich discussion. I'd like to start by talking about the cultural, legal, and economic factors that might make it difficult for survivors to exercise control over their reproductive choices. And so I'd like to start with Dr. Johnson Freese. Can you talk to us about some of the cultural and legal or economic factors that might make this difficult in families?
Yeah, first I'd like to say I'm so impressed with the work that Sadia and Lakisha are doing, and you too, Tunisia, at the state level. I tend to work at the national level, and to see the activities that are going on at the state to try and put into place protections is amazing and laudable. Because what we're really talking about is women's agency. agency to make decisions in their best interests. And the barriers to agency are both cultural and structural. And the structural ones that you are working on in California are, again, amazing and laudable. In other states, they are so far behind and even regressing in so many instances. And I think part of that is because again, at the national level, agency takes on a political tone. I hate to say it, but a political tone that those who consider themselves liberal tend to see agency that should be granted across the board. All women should have the right to, all individuals should have the right to. But those of a more conservative political stance see agency is something that you gain through individual hard work and merit. But that assumes a level playing field that doesn't exist. So, again, in our current political environment, we're hearing a lot about, people just need to toughen up and pull on those bootstraps. Well, in some cases, there are no bootstraps. So I think, there's the whole legal aspect to deal with. And then even when legal protections are put into place, then you have to get around the cultural barriers. And the cultural barriers, are everything from race to just across the board misogyny to different cultures. So this is such a multi-layered, complex issue that we are dealing with. Again, I think what we're really trying to get at the root at is how do we give women agency to address these? And we know, for example, if a woman does not have economic independence, she's trapped. She's trapped, and the more children she has, the more she is trapped. So, all these factors come together, and our current political climate is one where we're not progressing in many states. We're regressing. I live in Newport, Rhode Island, and even here there was discussion of our birthing center closing. So if that's happening in Newport, Rhode Island, and we can only imagine what it's like in many states and areas of the country.
Um, so who'd like to address the question next?
I can jump in and just Dr. Freeze already mentioned quite a lot, but I think what comes to my mind is just the fact that forced birth is something that unfortunately ties heavily into culture and religious aspects as well, and what we tend to see, particularly with young adults. Um, and this is where abortion really, connects with forced marriage as well, is that when a young adult, particularly high school students, if they become pregnant, whether the other individual is an adult or a child themselves, they are often forced into not only giving birth because of religious stigma or cultural community stigma, but there's also this other element of, well, because you're having this child with this person, you now have to marry them. And we're not going to give you the option to not give birth to this child. So therefore, you not only have to give birth, but you also have to get married to this person. And so that, without I think without even realizing what forced marriage is or what it looks like, a lot of people are falling into it, forcing it into their communities, forcing it on their children, when they take that agency away from their children and forcing them to take on decisions that they may not be ready for or that they truly just do not want to make, which is just as valid as not being prepared. So that's kind of how it shows up in the forced marriage realm. The other thing we often see is when individuals are forced into a marriage, oftentimes, especially if there is conflict, which is to be expected, if you're marrying someone you've never met, you'd know nothing about them. Folks are often told if you just have a child, things will get better. It's a very, very common thing that's told to women, not just in cases of forced marriage, even in marriages where folks do, you know, have chosen who their partner is. this element of if you just give birth, things will get better. It'll bring the family together. He'll be kinder, he'll be more loving. And even these conversations often tend to take place in the sense of a hetero marriage. And I do want to acknowledge that there can be elements of forced reproductive decision making even in non-hetero marriages. But I, wanted to acknowledge that as well. But that's what tends to show up in the work that I'm doing. Oftentimes, especially when a survivor is 15 or a youth, not fully an adult, there's a 50% more chance of intimate partner violence and controlled coercion towards birthing as well. So right now, I think a lot of um, DV agencies and even just community centers aren't equipped to support individuals that are facing forced marriage and forced birth at the same time. And so that is a conversation that I'm hoping in the coming years that our communities will learn how to engage with, learn what, individuals might need when they're facing these situations. And so this is, I think for the state of California, we're in the very early stages of this conversation, unfortunately.
Thank you, Sadia. And you know, I keep thinking that so many folks don't see the intersection. We are not single issue people. And of course, Black Women for Wellness, although we look at things through a reproductive justice lens, reproductive justice, it encompasses so much. And our four tenets, the right to have a child, the right to not have a child, the right to raise those child or children in safe and sustainable communities, but also that right to bodily autonomy. And so this hits right home and right in our warehouse and right in our backyard. And it's one of those things that people don't realize that it's interconnected, not just socially, but also legally, economically. And we still have those harmful stigmas that persist around our bodies and that women if we look at the historical context, and I always have to go there for just a level set for people, um, women, wives, children, they were thought of as property. And the sad part is, and I learned this when I was actually training to be a CASA when I was an undergrad, is that we had protections in place through SPCA before we did children. And that was hard to grasp that, I love pets. I tell people all the time that, I know stranger danger and avoid those white vans with no windows, of course. But if you have a cute little pup walking down the street, I'm like, oh, look at you in your little vest, and they could probably just throw me in and take me. But it's one of those things where, what are we valuing? How are we valuing women? How are we valuing and teaching our young girls and our youth about themselves? I can say that we do have a rites of passage program that centers for girls from 14 to 19 and just teaching them about their bodies, teaching them about their sexuality, understanding, hey, this is normal. This is okay for you to feel this way, these hormones, these things that are happening. And how to also, we have another program called Get Smart Before You Get Sexy, teaching them, hey, before you try and grow up so soon and so fast, enjoy these experiences, really embrace life and really, embracing them and saying, hey, we want to make sure that you understand what's going on and how to be an advocate for yourself. Don't allow things to happen to you if someone is touching you or approaching you in the wrong way. Who can you go to for that safety and that safe space? And just really advocating for themselves, teaching them from very young to say, hey, I don't consent to this. Um, and we do know that it's way deeper in other cultures where this is just a way of life. This is just how it is, where we're taught to get married and have kids before even getting an education. So, really just kind of driving home those points of, hey, your body is your body, advocate. We will educate you for anything that you need. And then also don't be afraid to lift your voice and say, hey, this is wrong. I don't like this. So, I think we're doing an okay job of it. we have so much further to go on this situation. And I can tell you, just seeing from personal experiences, I had friends that had children young in high school, and seeing how it didn't stop them for reaching goals and achieving these things. However, it does change the trajectory of things, and you have to take into consideration this whole nother life. Whereas in this situation, people are being forced into that situation. And we have to do a better job of getting to our youth earlier and sooner. And also saying, hey, we're not trying to discount what culturally has been in place for many, many ages. But also understanding that this person does have that autonomy over what they want to do and have a say over what happens to their body. And they should be free from that type of violence, especially intimate partner violence. That is not any form of expression of love. It is an expression of control.
Thank you. That was a lot. There was a lot of meat on that bone. And so I wanted to um, direct this question to Sadia, but the other panelists are welcome to add in some thoughts around it. And I'm thinking about how people can escape or resist coerced marriage, forced marriage, and control, particularly when immigration status might be involved. So, if we are contextualizing it in this current political moment and how dangerous it is for people who are out of status, legal immigration status here, and then to think about this issue of forced marriage or coerced reproduction. What are some ways that people can try and escape that?
Absolutely. That's a really important question, Tunisia. And I think, unfortunately, the US really lacks in this particular realm of how to support survivors of forced marriage. I know the U visa is something that folks can typically access if they're facing any form of like physical, mental abuse, and so forth, or if they're a victim of certain crimes within the US. However, when I'm thinking of young children who have been forced into a marriage, the likelihood of them even being aware of these resources is very low. And I think this is where even agencies like our own, it's great that we are working on this issue and that we are aware of how to spot forced marriage, how to support someone dealing with forced marriage. But the vast majority of American centers are not equipped with this knowledge. There are very few, and they typically tend to be agencies that are working specifically with South Asian communities, which is wonderful that they're aware of this. However, I think this is a huge, area of growth for us in the US. I know some folks, oftentimes children will reach out to their high school teachers or another trusted adult and say, hey, I'm dealing with this forced marriage situation, but it oftentimes it goes completely unreported because the folks that are most impacted by this don't even know how to ask for help or who to ask for help from, just because we don't talk about this issue at all within our communities. um, the other thing I'm thinking of also is the fact that with the US in mind, it's really complicated. um, like the issue of forced marriage is so complicated because oftentimes the youth that are being forced into marriage are typically already citizens of the US. There's very few that are not. The ones that are not are often ones that are being brought from another country to the US to marry like a much older individual here in the US. And so the level of, control that exists in that setting is so much more higher than for those that are born and raised in the US. And I'm particularly thinking anywhere from language skills. How do you even reach out and learn to ask for help if you may not even speak the like English, or it's hard to know what the laws are in the US versus other spaces. I'll just speak for myself. When I experienced my forced marriage, I was sent to the UK, and in the UK, funnily enough, they speak English. I spoke English, they spoke English, we all spoke English. But even then, and I was 19, I was not I wasn't a high school student, but I did not feel safe enough to even ask for help. And when I did, they said, "Oh, it'll be fine. You're going to be okay." And so, when you're told that, it doesn't help, right? And I had a lot more privilege in being able to speak the language. I, was an adult there, but still the systems failed me. And eventually I did get a restraining order, but that came so much after the, after rape, after being forced to give birth, after all of these things had already happened. And so I just think of the fact that if someone like myself who already spoke the language, who understood that this was something that was wrong and I should have been able to ask for help, still struggled to get that help because of the way I was perceived. These barriers might not exist in our laws, however, they existed in that one-to-one human interaction where, it shouldn't have existed, but it did. So those are just some of the things that come to mind. Unfortunately, I can't share any stats because we don't collect them in the US for whatever reason. We do, we spend a lot of time collecting stats and data for other countries, but we unfortunately don't have exact statistics for the US. So I'll just wrap it there.
Okay. Did any of our other panelists want to talk a little bit about that? Or I can move to the next question. And oh, it looks like you might have Dr. Johnson
Well, I was
Freeze.
just going to say, I think there are, it is such a complex problem and it's so country dependent that I know in some countries, I'm thinking of Ethiopia in particular, they have developed programs, and at one point USAID was very involved in this, where they turned to peers to help identify, because a young woman was afraid to speak up for herself, to have their peers put an anonymous note in a basket somewhere at the headmaster's desk or a police station so that someone could step in and try and help, because again these were 13, 14-year-old girls in some cases. I think there is a lot we can all learn from each other, and I would strongly like to advocate that we try and do that. Brazil has come up with these amazing women's houses where all in one facility there's a prosecutor, a police station, a psychologist, and if the woman can make it there, she's protected. We different countries have come up with different solutions that we can all learn from. And I think it's important that we do.
Wow. That is interesting because I think Family Violence Law Center is situated in a family justice center. And so that example that you just provided about Brazil is similar to that concept where it's a one-stop shop and you have local agencies who deal with gender-based violence that can provide services and support in addition to being able to work with law enforcement and those who manage that case if there's a criminal case attached to it.
She can get a restraining order the minute she walks in the door. Yeah.
Excellent. So that's great to know. My next question I wanted to direct to Dr. Johnson Freeze is, and I want to think about this from a peace and security lens, since that is your background. When we start to think about sexual violence and forced pregnancy or contraceptive sabotage, how does that disrupt peace and security in a country? So if we're zooming out, way out here, when we
Yeah.
start to think about peace and security and how the sexual violence can be a crime of war, but it's also there's a psychological element, and then there's some things to think about rebuilding after those times. So if you can talk to us a
Yeah,
little bit about that.
women hold together the fabric of society. That's been shown time after time after time. And we know, again, from empirical evidence that the audiences that I very often work with, which are military or security oriented, I've had more than one somebody say, "Well, that's your opinion, Joan. Show us some facts." So there's been a lot of work done to come up with these facts, these statistics. And we know statistically, again, that in countries where gender inequality is high, they are more than twice as likely to be violent, more than three times as likely to be corrupt, autocratic, because again, this first political order, if there's violence in the home, it translates to become the default method of problem solving in the community and at the national level, and even at the international level. We know, China, for example, the sex ratio in China is very off. There are by far more men than women because of some of their past one-child policies and other policies. And China considers those men untethered to families and society as very dangerous, that tend to be more crime oriented, more violent, all those things that tie into national security. We know that gender roles, again, in examples where a woman is not considered a woman unless she has X number of children, and a man is not considered a man unless he has a wife and many children. In Nigeria, the Boko Haram brides, those women, those children were stolen to act as an enticement, a recruiting enticement for men who couldn't afford to buy brides. Join Boko Haram and we'll give you a bride. And then, of course, these women, these children, these girls who became Boko Haram brides, when they were then rescued and returned to their community, they were very often rejected by their own community as being damaged. Honor shame societies. It gets into what Sadia was talking about. So we know from evidence, not just anecdotal, but from hard evidence, that economics are better when women are in the workforce. We know that for every year of school, additional school that a girl has, the chances that she will be safe giving birth go up. So the connection between all the data is there. It is unfortunately in many countries ignored. In some countries, it's acknowledged and incrementally addressed. But in my little world of security, I talk about if we were to acknowledge the relationship between gender and domestic violence and reproductive rights to security, we would be much better off in terms of our own security. And then you have to wonder, if it isn't, why not?
Thank you for that. I definitely understand, because as we experience this current chaos and looking at the dismantling of rights, it does feel like our peace and security is being interrupted and is at risk, which has, I don't know if I've ever felt that way living in the US before.
Yes.
I'd like to address the next question to Lakisha. And you spoke earlier about some of the policy changes that Black Women for Wellness has been working on. And so I'd like to zoom in a little bit and look at some of the changes that we're seeing in access to abortion or access to reproductive health care, Um, how do you think that impacts survivors of domestic violence? And again, we're looking at this across the lifespan. So, for youth and for those in their reproductive years and those who are beyond their reproductive years, how are these changes impacting people, and their ability to access reproductive health care as survivors?
I think the main thing that we need to look at first is that um, we have to recognize that reproductive freedom and safety from intimate partner violence are inseparable, that they are, again, that intersection that happens, and it's an unfortunate happening, but to realize that those survivors of domestic violence, in this particular against certain cultures. It's in the Black community. It's in a lot of Muslim communities as well, a lot of Middle Eastern communities, gender expansive people. It runs the gamut. Um, but with these recent restrictions and that kind of instability in reproductive health care and just women health care, that access, it's made a difficult situation more dangerous. We're seeing that ripple effect. It's not that we could just worry about California because on the federal level, we're seeing just the dismantling of those rights, like Dr. Johnson Freese was talking about, and how you were saying how this is the first time you're feeling like unsafe in your own country. When we're seeing the things that we've seen with the funding of like Planned Parenthood and that's not just Planned Parenthood. There are lots of other organizations that fall under that umbrella. And I have to uplift one of our coalition partners with women health specialists. When they're defunded, it's not just access to abortion care. They lose that critical pathway to their autonomy, to their safety. And that's where that reproductive coercion kind of comes in, like the partner sabotaging contraception. I learned about this when I was younger, because I had an aunt, fortunate to have an aunt who worked at an OBGYN office for two doctors, right? Two doctors of color at that, and they were males. So that was even amazing. And I was not even I was not aware that that kind of thing that went on. And then having it goes into the forced pregnancies and using the children as a control mechanism. And I saw that through my work with CASA, where they are basically saying either you can go and not have your children, or you can stay and have access to your kids. And what person does not want to stay with their children? So when you're limiting that access to abortion, healthcare, or contraception, those survivors can just feel trapped. And so it just continues to increase their dependency on that abuser for that financial and that emotional support. Um, and I'm just going to call it out. It's just compounded by the fact that there is systemic racism that exists, and that economic inequity. So, those structural barriers like the lack of insurance, a lot of folks, you don't have access. Those survivors and the victims, they are dependent on their abuser for that access to insurance. And then we have the issues where financially on the federal level, when they're withholding those dollars, that leads to clinic closures, that leads to travel burdens on those who are already just kind of navigating poverty and discrimination and that medical bias. And it affects that entire spectrum from our very young, because the children are, they're witnessing this happening to their mother, and then they're carrying that emotional trauma as well as they're trying to navigate this. So they face that just greater fear of seeking care, and they're often kind of just kind of forced. Like, do I want to be criminalized? Do I want to be ostracized? Do I want safety? And how do I distinguish between the two? I think the larger issue at hand is that we have a system that just undervalues bodily autonomy for women and their safety. And we need to really reform our healthcare system so that it prioritizes agency, And it enforces that confidentiality. And the reason why I'm touching on this is even those who are seeking that help, and we're seeing it right now, even in LA and now Oakland today with the ICE raids that are happening, that issue of confidentiality, if they're going to seek some help and they have a mixed or a different type of immigration status, what kind of tracking devices are they using? What kind of questions are they asking that they shouldn't have to ask about someone's citizenship, but can also trigger them to be targeted as well. So we need to reform this system where it is just going to allow us to make those decisions about our bodies that are free from violence and coercion. And it starts with educating our providers. It's sad to say that even with our our medical system right now, we do have doctors coming out and they're saying, hey, they're still teaching that same bias. They're teaching that same, racism and those issues, and they're still ostracizing folks based on their social economic conditions. So it comes from a whole place of reform that we have to do when we're looking at this from the reproductive justice landscape. And I think that's the main things that we can do. But I do have a good point today. I will say that I got an email that our governor here in California has actually given Planned Parenthood and organizations $140 million to help them continue their work because as of today, there were over 30 days of still providing not only abortion care, but also family planning and all of those women health care services. They were billing like Medi-Cal and Medicaid and not getting reimbursed for that. So at least that is happening, but we still need to do that more education piece with our healthcare providers to recognize those signs, to reach out and do that extra step to make sure that, if this is a person that is in danger or in a relationship that is exhibiting that violence or control or coercion, that they are getting them to the necessary help that they need.
Thank you for that. I wanted to ask the last couple of questions because I know Sadia has to she has a hard stop at 1 o'clock Pacific time. And so what I'd like to ask is do you think the legal system current has an effective way to recognize reproductive coercion as a form of abuse or reproductive sabotage? Does the legal system do we currently have that in our legal system? And then also talk to us a little bit about just one change you'd like to see, one policy change that you would like to see at the federal, state, or local level that could help in this process. So again, we're looking at two different things. We're looking at does our legal system currently recognized forced reproduction or coercive reproduction, contraceptive sabotage as a criminal act? And then one policy change you'd like to see in the next year. And Sadia, I know you have to leave at 1, so let's have you go first.
Yeah, absolutely. So I think I'll start with the second question first on what policy change I think I would like to see is even at the federal level, I think having so the gosh, where do I begin? The federal government does not fully recognize forced marriage as this issue. Like we have it kind of vaguely mentioned in a user manual here or user manual there. We vaguely say we think it's a human rights violation, but there's no law, there's no like anything in actual text that would be of impact to survivors. So even just a recognition of the fact that forced marriage exists in the US, that, this is what it looks like, this is the type of supports we should have in place. Those things do not exist at the federal level. And I think if this conversation were to begin at the federal level, it would allow states to catch up so much faster versus what we're trying to do in California, which is trying to get California to fully recognize forced marriage as a pressing issue in this time, in this moment, and how to address it. You know, us as FELC are working on this issue on our own. However, I can't imagine how long it'll take for all the other states to catch up to that. So having the federal government recognize this as an issue, define it for what it actually is, and create like forced marriage protection orders in the same way that the UK, Wales, Scotland, many other countries have already done this. Many of them have actual forms that can be used at any place within their jurisdiction or even extended jurisdiction. In fact, the UK just recently, I want to say about 2 years ago, made it so that a victim of forced marriage can file for a restraining order with the UK, even if the victim themselves have no relation to the UK. So long as the perpetrator is from the UK, they will grant you a restraining order that their government will enforce should they violate it. So imagine that. Typically most restraining orders, most states want both parties to be from the same state, to have some sort of affiliation, but the UK went as far as to recognize that this is a global issue, that no matter how proactive they feel they're being within their own country, they may have victims that are not from their country, and that they will need protection from individuals within their own country who are UK citizens. And so that is a type of, level that the US should have been at already, but we are not anywhere near even acknowledging that. And it's quite ironic for the amount of billions of dollars that we send to other countries to handle this issue in their own countries, and we don't do that here. So I think those are some of the immediates that I can think of. I think even just training our own federal staff, our state staff on even recognizing the issue would be a huge step in moving forward, particularly when you're thinking of, any agencies that work directly with families or children would be an immediate thing that we should be doing. Do I feel we have adequate laws to kind of address reproductive harms? I don't. I think the technical answer that you would probably get from our legislature is that all of this just falls under the domestic violence restraining order, and that you can handle it all through that. And I disagree. I think it has some protections, yes, and definitions within the domestic violence restraining order have significantly like increased, and we've expanded definitions on what disturbing the peace might be, or what, certain aspects of qualifying acts might look like. But the reality is there's so much nuance to these issues, particularly forced reproductive harm and forced marriage, that, you can have an expansive definition, but that doesn't mean anything if judges don't recognize that. If judges don't see that this is what this is intended to be, then they're going to go with what they're familiar with what they're used to, until there is very clear language or instruction for them to do something more than that. And so I personally do not feel that we have adequate um, laws or restraining orders or anything for that matter when it comes to specifically um, fighting back against forced reproductive harms and as well as forced marriage. So I think there's so much more that we could be doing in that realm. Hence the need for us to even write this forced marriage protective order that, we're hoping to pitch to the legislature soon. And I hope that that is something that California can make happen in the upcoming legislative cycle. But until we have something that directly calls out the actual act and says this is bad and we need to change this, I don't think we'll get there. So thank you.
Sadia, that's amazing. I'm sorry. I just had to, whenever you get this legislation, we will happily, our action project, sign on and support in any way, be in partnership and coalition with you in solidarity. And if I may, Tanisha, may I jump in right quick?
Yes, please
Awesome.
go ahead.
And I think that Sadia really hit on this. And of course, the doctor is doctorate in law. So I think the main thing is that liberation starts with listening to those who are most affected. They need to acknowledge that economic abuse, that forced pregnancy, that restricted abortion access, they're all interconnected in their forms of control on folks. So making sure that they have that access to not only like stable housing, paid family leave, accessible childcare, all that stuff. But it all falls under that umbrella. And that training piece, Sadia, that was the thing that got me because, for this legal system to better protect survivors, it has to explicitly include reproductive coercion in the domestic violence statutes. It has to be there. It has to be in the protective orders. It has to be in all the TROs. And it ensures that, survivors that they can seek justice and safety at the same time. So I think our laws need more. In fact, I know it needs more mandates for the training on judges, on those healthcare providers, and our law enforcement. And I know that they're saying they're asking a lot of law enforcement, but unfortunately, they are the first point of contact a lot of times, and they don't have that training in social justice issues. So they need to know what reproductive coercion is, how it manifests itself, and especially in our marginalized communities. Also to give them, to accompany this is more like trauma informed and culturally competent services, right? So when someone is seeking out that help, they don't get that punitive response. We've seen what happens when someone is seeking out for mental health services, and instead of getting that help, they're being criminalized. They're put in the biggest a quote unquote mental health service there is, which is the penal system, right? So we see how that has happened there, and we don't need that to repeat for people who are already victimized by their intimate partners. So I think we need to do that more protective stance. We have to educate, we have to mandate, and we have to make sure that this language is spelled out specifically in the language and that everyone's aware of it and acknowledges it, knows how it manifests itself. And that's how those protections are going to come into play.
Okay.
Yeah, there's been so much covered. I would add on just a couple points. Unfortunately, I don't think our federal government, again, in the current political environment, that we can expect much from them in terms of help in these areas. I mean, when we still have 20 states that allow rapists to co-parent, and these are not laws that were decades old. These are being renewed in very recent times. So I don't think we can put much hope into the federal government. We're currently in a system of minority rule, but that's what we have. So I would like to see a couple things happen. One, I would like to see, as Sadia mentioned before, data. I would like to see mandates for more gender disaggregated data on everything across the board that has to do with security, reproductive rights, and that gets to I would like to see one of the points of the Women, Peace, and Security framework that I work on is participation of more women across the board in security sectors, more women police officers. We know we think that it's human nature for fight or flight, the response to threat. That's not. It's a male response. The female response is tend and befriend, and women de-escalate situations. So having more women in police officer situations, in prosecutor's office, et cetera, is, I think, imperative as well. And since we can't rely on the federal government to step in and mandate some of these things, what about the American Bar Association mandating training for judges? What about state bar associations? What about state police associations? And again, you're not going to get it in every state, but for the more states that do it, the harder it gets for the others to push back. So again, it's not. I think we have to create our own bright future, and I think the intersectionality that has been talked about today in so many different ways about issues we have to make it happen among everybody, among women, among groups, around ethnicities and cultures, because women and children are first and hardest hit by chaos. Women as a group. And if there are women who think that they can escape that, they won't escape it for long. So I'd like to see more of that happen as well.
And as you were speaking, something came up for me actually, which is that there are many states and countries that actually reward rapists for marrying the person they raped, particularly if there is a child, like if the rape results in pregnancy. And so that, we're rewarding bad behavior, we're rewarding the complete violation of another human being's life, dignity, and, their entire life, really. And the fact that, like, even Florida, I think they changed their law maybe about 8, 9 years ago, maybe 10 years ago. And that was the result of a forced marriage survivor, stepping up and saying enough is enough, because she was 9 when she was raped by her church deacon. By 10, she was already a mother, and by 11, she was forced to marry this man so that he could protect his career, so that he could continue to work with children and adult within a church setting. And, and this resulted in a lifelong battle for this woman. She was in multiple abusive marriages following that, because that was the life that she grew up with since 9 years old, and she had multiple forced pregnancies that she did not want, but she now had to learn to become a mother as a 9-year-old to another baby. And the other thing that comes up around this is the fact that while we might not have clear data for the US, what we do know is worldwide there's about 22,000 deaths annually where young girls die from complications related to childbirth as a result of child marriage. And so that's what we're looking at. We're not just destroying the lives of these young girls, but we're also destroying, the lives of the babies that are born as well. The babies that are born in these situations to young mothers who are forced into marriage, have sorry, the word is slipping me, but there tends to be more complications. Those children tend to not live as long or have medical complications, because they're being born, under such violent conditions. The risk of death is higher for those babies that are born. Though they tend to have lower birth rate, they tend to have much more malnutrition, and just developmental issues as those babies grow. And so not only are we allowing the lives of these young girls to be destroyed, but we're further destroying the lives of those babies that are born as well. And that's the part where I think, yes, the focus should primarily be on the individuals that are impacted themselves, but we also have to consider the fact that we are creating this cycle of destruction and violence. And that's something that we're not paying enough attention to. And so, those are the things that I would want folks to walk away from this panel with, is that we truly need to have a human approach to these things, and we need to think about what each and every single person needs in these situations. We can't just make blanket policy on what we think we know about an issue. This is where survivor voices are the most important, and speaking with survivors is what should be leading the policy efforts. And I say this, you know, primarily even to myself as a policy advocate. I cannot pitch for policies if I don't bother to actually reach out to and speak with survivors that are going through this themselves. And so, and that should always be at the core of what we do as advocates, as leaders, is, checking in with the community that's actually impacted before we come with our own ideas.
And I'm so glad you brought that up, Sadia, because one aspect that we didn't mention here is not only just cultural, but also from the religious aspect, because we see this a lot in that indoctrinated rhetoric of, you're rewarding that person for marrying this child, and then that predatory behavior just continues, and it's a cycle. And whether or not they take on more children and victimize them as well, now we're conditioning those that are witnessing this, that this is normalized behavior and it's completely abnormal and we should be calling it out for what it is. So definitely we need to work on that, working on those laws. And then, of course, that data, everything has to be rooted in community. Every bill that we try to run forth, we start as a community issue. They come to us. How can we tailor it? What's that North Star? What are the things we need to focus on and keep that as guiding us as we're pushing through that legislation? So we have to center those voices. We have to make sure that they're uplifted, because if we don't do it, then they'll get lost and we'll get some watered down version that just does no good, to those who are intimately and directly affected.
A last word, Dr. Johnson Freese.
Yeah, I would just again like to thank you for this opportunity because we all learn from each other. We all get ideas from each other, and it's nobody can attack these issues alone. And the more we network, the more we work together, and the more we educate. As a lifelong educator, I'm all about you can't fix a problem that you're not aware of. Um, and the more we can share with the public and with those who basically push back. Sometimes we refer to them as blind fish. Sometimes people don't understand the environment that they live in. And not all of them will accept knowledge, but some of them will, and that makes a big difference.
Well, thank you for that. I think this was a very rich discussion, and I would like to thank our three experts, Dr. Joan Johnson Freese, Sadia Khan, Dr. Lakisha Camese, for helping us highlight this issue of reproductive justice, the intersection with domestic violence, reproductive coercion, and some of the policy changes that we'd like to see at the state, the national, the international level. And that big piece, the data piece, is so important. And so it is wonderful that we did some community organizing and building right here. We just got 5 different pieces of legislation in this conversation, in addition to this request for more data to be able to speak effectively about these issues. So I thank you all. My team thanks you. And we will be in touch. Please send me an email so that when we write the description of this, we can include your social media or how to get in contact with you for those who would like to volunteer, donate, or find out more about your work and research. Okay. Thank you. Have a great rest of
Thank
your
you.
day.
Thank you.